Good morning, everyone. I'm Dr. David Wild, Vice President of Performance Improvement here at the University of Kansas Health System in for Dr. Steve Stites this morning. We're coming to you live from the Dolph Simons Jr. Family Broadcast Studio. Today, Dr. Carrie Wieneke, Chair of Obstetrics and Gynecology, joins us to answer questions about the COVID vaccine and pregnancy. But first this morning, Dr. Dana Hawkinson, our Medical Director of Infection Prevention and Control, is here with our numbers. Yeah. How do we look this morning, Dana?
We're holding steady, kind of bouncing between those low 30s and high 20s. 33 active infections with 8 in the ICU and 2 on the ventilator, still with 36 in that recovery period and 2 on the ventilator. Hays also is kind of holding steady, 16 total patients, 8 in that acute phase and 8 more in that recovery phase. So, as far as capacity, the last few weeks we've been fairly happy about that.
Yeah. We have definitely learned to manage 70 patients in our hospital, which is its own sort of reflection on the last couple of years, but nonetheless. All right. Well, before we get to the conversation about vaccine and pregnancy and our reporter questions, I did want to spend a minute and answer some of the more frequent questions we get about vaccine logistics, numbers, insights into the process, and of course what you can do to help us as we work tirelessly, really, to make sure that anyone that we have a vaccine for can get vaccinated as quickly as possible. So I sent Logan this morning on short notice, as our control team is grinning at me, a couple of slides to help tell this story. The first is just the picture of where we are nationally. Again, this is right from the New York Times data tracker, which is based on CDC information around vaccinations that are actually administered. And the picture is maybe changing a little bit. 2 things to note from what this picture looked like a week ago at the national level. The scale is still compressed, right? The difference in those 4 shades of green is only about 2 or 2.5 percentage points. So it's not like the worst performing states are significantly behind the best performing states. But that range has shifted slightly. So last week it was maybe 7 to 9% or 8 to 10%, and this week the range is somewhere between 10.5 and 12.5. So that in itself is good news. You're also starting to see a few more states get into that sort of darker green, and that is, of course, good news as well. On the local front, you can see Kansas, Missouri, Nebraska are all lighter shades of green. Kansas, as of now, is hanging out just over 10%. So just over 10% of our population has received a first dose. And about 3.5%, approaching 4% of our population has received both doses. So that is movement, no doubt. Last week when we talked, we were in the 7 or 8% range, and we continue to work, I think, as we talked with Dr. Norman about on Tuesday morning, to get the data about vaccines administered from our newer vaccination sites across the state into the CDC system to actually show or better reflect the number of individuals that are vaccinated. But nonetheless, some movement at all levels across the country, but still a small percentage overall, right, 10% or so of the population having received a vaccination. So we wanted to talk a little bit about why that is and how complex the process is right now. And actually right now is not necessarily any different than it was a week or 2 weeks or 3 weeks ago, outside of the complexity of whether in the delivery process, not in the ordering. So this is actually a slide directly from KDHE that talks about what ordering at the state level and shipment and then delivery of doses, vaccine doses, to the place doing the administration actually looks like. So the dates or the days of the week may have shifted just slightly here from this slide, but the general picture is the same. Early in the week, on Tuesday maybe, states are told how many doses will be available in this ordering cycle to the state by the CDC. And then the state goes through the process of deciding how they will allocate that specific number of doses to counties based on a number of factors, based on uptake in the county, the number of doses that are still available to be administered at the administration sites in that county, and any requests from specific counties not to provide more doses this week, for example. And then that happens on Wednesday and Thursday, and then around Thursday or Friday, the ordering happens from the federal government. And those doses then, that ordering sort of tells everyone at the provider level. Right now, that's the county health departments. Earlier in the process, that was a hospital or other provider. But that sort of gives the idea on Friday, usually, to the provider how many doses they'll have coming sometime next week, because the shipment takes between 1 and 5 days and usually arrives here sometime around Monday or Tuesday, or if there's a delay like this week from the weather, maybe Wednesday or even Thursday. But the challenge with that is we don't know until sometime after Friday each week how many doses we'll have the following week and what day they will come. So we have a narrow window after getting that information to turn around and identify the patients that we will invite to be scheduled, to get them contacted, to schedule them, and to bring them in. Despite that complexity, though, we've been working very hard, as nearly every administration site has, to make sure that doses are administered within 7 days of arrival here. And that is, of course, our goal with first doses. And second doses are scheduled based on the timing. They're independent sort of from this first dose ordering process, and they're scheduled based on the timing of your first dose. So despite all of that complexity, I thought it was helpful to share just a little bit of the numbers that help back up what we've been able to do here. And this is true for every place across our state and really across the country that are so actively working to administer vaccines as quickly as possible. And so through let's see, this would have been through Tuesday's clinics, we had administered more than 18,400 first doses and more than 10,000 second doses. So a lot of effort to providing vaccine here, especially when we're getting, at the present time, maybe 900 or 1,000 doses a week, maybe 2,000 doses on a big week, based on that variation in the ordering process and the doses that are available. And so that helps give you a picture about what is going on. Of course, when we end up scheduling lots of vaccine clinics for Thursdays and Fridays because doses come on Mondays and Tuesdays, that has meant that we've had to also figure out, in order to get those doses into patients' arms as soon as possible, how to do weekend vaccine clinics. And last weekend was our first foray into a weekend clinic on our Indian Creek campus. So those that are familiar with that campus, it's a campus at basically 435 and Null in Johnson County. And as we have learned, every time we have started a clinic, whether it was with our employees here in one of our university spaces, whether it was the beginning of public or patient-facing vaccine clinics in our medical pavilion here on the main campus, or as the case was last weekend at the Indian Creek campus, we learned things very quickly about how the process will work. And Saturday was no different. So many of you may have actually seen or heard about that process. We ended up with a little bit of a line for about half an hour. And out of that experience, as we changed our process in real time to make sure that the line was not extending outside and that we were managing the flow of patients into the clinic to match, for example, our ability to vaccinate, or the number of people we could vaccinate in any given period of time, we actually learned that there are some things that we need each of you to do as you prepare for this. So we actually learned that people were coming hours before their scheduled vaccination appointment because they were worried we were going to run out or the weather was going to get worse. And I can promise you, if you have an appointment scheduled, we will have a dose for you. It actually makes things harder for everyone in the building and everyone managing that process when we have patients come before their appointment time, especially if it's several hours. We also learned that all of you who have family or spouses or close friends who have not yet been invited through our process of randomization, we learned that you like to bring those people with you in case there might be a dose available for them. And while that's understandable, it also gummed up the system, if you will. We didn't have doses for people who didn't have appointments scheduled, and having to have those conversations sort of slowed our process down as the day went on. So please, if you don't have an appointment, don't come to a clinic, but know that if you're on the list or you've indicated your interest to receive your vaccine here, we will be contacting you just as soon as possible to safely be able to get you your vaccine dose. And finally, we know that the situation around second doses has not changed, meaning wherever you got your first dose, you will get your second dose. The process of allocation, as I mentioned, of second doses is completely independent of the first doses or changes in weekly distribution and ordering. And we continue to have questions, some via phone or via electronic system, and some actually in person at our clinics about challenges getting a second dose, or I don't have a second dose appointment yet where I got my first, can I just get it here? And we pair and match first doses and second doses so closely that we don't have an extra second dose. And we don't have the ability to give second doses to people who did not get their first dose here. And there's really no need, because that place that gave you your first dose will be able to provide your second. It might not be exactly at the 3-week or 4-week time frame. And we know that many of our county health department and other pop-up clinics schedule days that are only first dose days or only second dose days in their clinic. And so that alone might add a day or two to the process from when your specific 3-week or 4-week time frame might be, depending on the manufacturer. But as we've mentioned many times, there's no real risk in that. In fact, there may be a little bit of benefit to a larger or longer time period. So hopefully that answers some of those frequent questions about what's happening, what the process looks like, why we go from not having an appointment today to having lots of appointments available to schedule tomorrow. We don't open any appointments unless there are doses that we know that we can use for them. And so until we know the delivery date, we don't schedule. We don't want to have to cancel someone or move them because we don't have doses. So that's a lot of logistics and information and insight into what's happening. We'll transition here in just a second to what that means for specific populations. Today's conversation around pregnancy, for example. But before we do, Jill, are there any reporter questions on the line today? All right. Well, then let's move to our conversation with Dr. Wieneke. We're going to introduce you first, though, to one mom-to-be who was also an employee here. Nicole Wolf is expecting her baby in March, and she made the choice to get her vaccine. Here's why.
She will know that she was part of history.
35-year-old Nicole Wolf and her husband had planned to travel in 2020, but worked on baby number 3 instead, another girl, due mid-March, almost a year to the day COVID first hit the metro.
A lot of my family that I'm very close to lives in Kansas City hasn't even seen us pregnant. They don't even know what that looks like because, we haven't seen anyone.
COVID has always been a concern.
My husband is immunocompromised. He has MS, and my oldest daughter has a heart defect. So up until the pregnancy, my focus had always been on them, making sure my husband was protected and my oldest daughter was protected.
So when Nicole, a perinatal sonographer at the University of Kansas Health System, was given the chance to get the vaccine, she didn't hesitate, even during pregnancy.
We've done the hand washing, we've done the isolation, we've done the put yourself in a bubble, and my kids have been homeschooled and all of those things. So what else can I do to make our family safe? And this is it. I don't feel like I am putting myself or my pregnancy at risk by doing that. I feel like, if anything, I am helping myself in my pregnancy, because we know COVID in pregnancy can be very, very detrimental to the mom and to the baby.
She weighed the risks.
The risk of getting COVID for a pregnant person was more severe, but the chance of getting it wasn't any higher than any of my peers.
She asked lots of questions.
Early signs of pregnancy have a lot of symptoms, and some of those symptoms sometimes mimic COVID symptoms. You're tired, you don't feel well, you're nauseous.
But she felt good knowing she was protecting her family, co-workers, and those closest to her.
That is empowering. I don't feel like I'm risking my pregnancy or my health to move in the right direction. And so for me, it was, what can I do to get back to true normal?
Dr. Wieneke, thanks for joining us this morning. I assume you agree with Nicole's choice to get vaccinated.
Correct. So from the beginning, we've been pretty firm on our stance that we believe that pregnancy or breastfeeding should not exclude you from getting the vaccine. In addition, there should be no additional sort of check boxes or requirements for you to receive the vaccine, such as a doctor's note or a doctor's signature. If you are of the group or in a group of people that are eligible for the vaccine, then you should have the opportunity to receive the vaccine just as someone that is not pregnant.
And with limited vaccine supplies and lots of people wanting to get vaccinated, what are you recommending to your patients about getting vaccinated and where to get vaccinated?
Yeah, so I think it's always a great discussion to have because each individual might be a little bit different. But in general, what we talk about is the risks of COVID. So, what is your day-to-day life like? Are you able to quarantine? What is your job? What sort of exposures do you have? What risks do you really have to getting the COVID infection? And then we talk about what we know about the vaccine. And it is true that neither study actively enrolled pregnant patients in the first round of enrolling in their study. So we don't have, unfortunately, data on pregnant safety, but we do know that there were women that did receive the vaccine that became pregnant during the study, and there were no adverse outcomes. In addition, we have the DART safety data from both vaccine trials, and there were no safety signals. So we discussed those, what we do know, and we have individual conversations with each patient. And really, for the majority of the patients, it's a recommendation to go ahead and receive the vaccine. There are some situations that a person that's very early and just had a positive pregnancy test but hasn't seen a heartbeat yet and has concerns, those sorts of things. But overall, most of our conversations do revolve around a recommendation for considering receiving the vaccine.
You mentioned the fact that none of the trials specifically identified a population that was pregnant women. And we know that early on we had some of our own healthcare workers who were moms-to-be who opted to delay their vaccination pending a little more information. What do you see coming as far as information to support those decisions in the near future?
Yeah, so a couple different things. The CDC started the app process, the vSafe process. So there are a lot of pregnant patients and breastfeeding patients that received the vaccine. So all of that data is being collected, although I don't know when we will receive the first sort of review of some of that data. In addition, both vaccine makers are looking to start sites to enroll pregnant mothers to receive vaccine in specific trials. And we are working here on campus to partner with one of those vaccine makers. So we hope to start enrolling pregnant moms sometime in March in our study that will be able to collect and follow those women, follow the babies, to really provide more data for future pregnant patients.
One of the other questions that we get often is, what are the risks to contracting COVID when you're pregnant, both to the mom and the baby?
So absolute risk is still low because the majority of patients are of that younger age. But we do know if we would compare a pregnant patient with the same age, same comorbidities to a non-pregnant patient, that the pregnant patient has an increased risk of having severe COVID disease, being intubated, being placed on ECMO, and having an ICU admission. So that is what we currently know. We also know that pregnant patients that have risk factors such as obesity, diabetes, high blood pressure, also are at increased risk of having severe COVID disease.
And when we compare those risks, what about risks or side effects for the vaccine, specifically in pregnant women? We've heard some conversation about it might make my nausea worse, or the fever may associated with the vaccine may be a problem. Are there things that you would want people to know about those concerns?
Yeah, so I mean, most of the side effects that we're hearing from the vaccine are time limited, 24 to 48 hours at most. So yes, some of the nausea can be worsened, but for a short period of time. You can have a fever, and acetaminophen is safe in pregnancy, and we recommend taking acetaminophen for a fever in pregnancy, of which would be safe after the vaccine as well. There are concerns that if you have prolonged high fevers, it can have an effect on the baby early in pregnancy, but typically what we're seeing following the vaccine is that's not a prolonged elevated temperature.
And finally, one of the other frequent questions is, what are the impacts of the vaccine on breastfeeding, whether you receive your vaccine while you're breastfeeding, or for those that are pregnant and plan to breastfeed?
Yeah, so, and I would say that the wording of all the national governing bodies is even stronger for a recommendation to receive the vaccine while breastfeeding. There really is little scientific plausible options or ways that it could be transmitted in the any detrimental effect could be transmitted in the breast milk. There are also studies that are currently being completed that are looking at the breast milk of women who have been vaccinated and then babies who receive that breast milk to see if any of the immunity is being passed, although none of those studies, endpoints or data are completed yet.
Great. So, Jill, let's open it up to questions from the community.
Yeah, the first question comes from Ella. Does the COVID vaccination affect fertility in women?
Dr. Wieneke?
Yeah, it's a common question. And it started from a Facebook post of an old Pfizer employee, but they're ACOG, our governing body, and then the ASRM, so Society for Reproductive Medicine and Maternal Fetal Medicine, all have come out with a joint statement that there is absolutely no scientific evidence or is plausibly scientific unlikely that will affect fertility. So there is no evidence or any sort of plausibility of the mechanism of the vaccine that would affect fertility. We are recommending, if you are attempting pregnancy, even in an IVF cycle, etc., if you are eligible for the vaccine, to receive the vaccine.
And when you're saying no plausible mechanism, that's really related to the vehicle of these vaccines, right? There's no way that mRNA can impact fertility down the road, or even a cycle that someone may be in at the present time. Is it? Okay.
What about COVID and infertility?
Yeah, so there is no effect that I have seen or am aware of COVID on infertility. We do know that there is any viral disease can have a short-term effect, for instance, on a semen analysis, or, if a person is ill, they might not ovulate, those sort of things. But that's a short-term. There is no long-term effects that we are aware of.
Isaac wants to know, do you have any cases of pregnant women passing COVID on to their baby?
Great question, and not that I am aware of here at KU.
Yeah, I would just like to add that, that's been the main thought going forward. Now we do, and Dr. Wieneke, correct me if I'm wrong, we didn't think it happens. We've seen published reports of it, but I think that the wording in the literature is it's still very rare for that to happen. A lot of neonates after birth, when you find that they are infected, probably got infected by close contact with the mom or a family member. But in rare instances, we have seen transfer of the infection from mom to baby. So it doesn't happen very often at all.
And when we mention in our experience and to our knowledge, we've had a fair number of moms that have tested positive at the time of their admission for their delivery. And so even if there is the possibility, I think we know, based on our evidence, that it really does support the fact that it's rare. If there is the possibility.
Sherry has a follow-up question for you in your discussion on the vaccine and how we get it. She wants to know, are you getting info 3 weeks out, which was indicated would occur by the new administration?
So the short answer to that question is yes. There is maybe a but. The information that is coming around the supply 3 weeks out is coming at the state level, not necessarily then in the allocation to the counties, and then definitely not in the allocation from the counties to individual vaccination sites. So there is some more stability in knowing that the number that is coming from the federal government is set, but that hasn't yet translated into a whole lot of specifics that allow us to plan better at the individual vaccination site level. Hopefully as supply increases and improves, that becomes less of an issue.
Elaine asks, what do you know about a study that says COVID impacts the eyes or your eyesight?
So I know that this has been in the news the past couple of days.
Is this the radiology study?
I believe a small study of those that had severe COVID disease that had an MRI that showed there might be some findings in the eyes. I think that's probably what we're referring to.
Yeah, if this is the one that was been in the news, it's a radiology study. So basically they have I think it was MRI of the head and brain, and they just found some findings, I think, behind the eyes. It's really unclear that there is a lot of effect of COVID in the eyes for eyesight and things of that nature. I would imagine it can happen. We've seen COVID affect all of the other organs. I don't know the clinical significance of that study. I haven't read the study, but just reading those articles, it doesn't seem like there was significant issues with eyesight. And these were more incidental findings from what I understood, but haven't read that article. And again, just as you said, it was a small study. It was from a radiology standpoint rather than an ophthalmology standpoint, and what is the clinical disease there and the clinical changes. Certainly we can look into that and ask some of our ophthalmology colleagues.
My understanding is exactly the same. I think if I remember right, it was 120 some odd patients that had MRIs that had severe disease. And of course, this was just really the beginning of our understanding of this question. The end result of that study was there may be clinical impact. We don't know, and we should screen for eye problems and eyesight issues for those with severe disease. I think that's fair.
Yeah, and we do know that either direct viral effects or collateral damage from the immune system, we know this infection can affect many different organs in our body. So.
How do women who are pregnant and they want to get the vaccine get access to it with the supply issues right now?
Yeah, so that's a great question. It probably doesn't really apply specifically or only to those who are pregnant. Carrie, any specifics around the way you've been answering that for your patients before I jump into generalizations?
Unfortunately, not a whole lot of I don't have any great way to get those patients pregnant either. I had a woman come in and asked if I needed a volunteer greeter at her front desk so she could be an employee. But I have no, at this point, pregnancy has not been listed in any of the higher levels that would move someone up to get the vaccine just because they're pregnant at the current time. And we certainly don't see a whole lot of pregnant 65-year-olds.
I was going to make that point. I think, Dr. Wieneke did talk about, we have seen an increase in complication rate in pregnant versus non-pregnant, but the main driver of what we can be thankful for is that you are seeing pregnancy in young people and not those older populations, which has really been proven out to be the main driver of severe disease and death is that age level. So just piggybacking on her point.
Yeah. And my sort of generalized answer would be the same. As we are really working on vaccinating those that we know have the highest, as a population, of course, not at the individual level, but as a population have the highest risk of severe disease and death if they were to contract COVID, pregnant patients just don't fall in that current phasing. And so there's not a broad and wide ability, unless, of course, you're included in the current phase in your area based on your occupation or your employer. And in those cases, as healthcare workers, have been some of the questions that we have received from our own team, there may be people who are pregnant who have access to the vaccine based on their role. But hopefully, come the summertime, as it's been said this week repeatedly, the ability for those who want it in the general population will be a little bit easier.
So Sandy, who calls herself our top fan, she says, she goes, I go to KU and I get my treatment and my medical health care there. How are you going to notify me when I'm eligible? Is it going to be by email, by phone?
Yeah, great questions. So the answer is any way we can. How we've started out is electronically. So those who have established MyChart accounts, and MyChart, for those that are not familiar, is sort of the patient-facing window into our electronic medical record. So if you're registered for MyChart and already received communication via MyChart about appointments, you communicate with your providers that way, you'll receive a MyChart notification. You'll also receive an email. And the reason for those electronic communications is because the easiest way to work out the logistics of your appointment is for you to self-schedule via MyChart. So you can see the available times and choose the one that works for you. For those that are not registered in MyChart, we have already been for several weeks working through a process of calling those patients who are randomized on our list but do not have MyChart access and do not have an email address on file with us. So you don't have to have an email, you don't have to be registered for MyChart. Those make it easier and faster for you to get your actual appointment scheduled. But for those that either don't have the ability to do that or would prefer a conversation with our call center team, they will reach out when your name comes up on the randomization list.
All right. Taylor writes that she had planned to get pregnant last year, but then with the pandemic, they put it off. But she said the pandemic just keeps going. So she wants to know, what does Dr. Wieneke advise in terms of the birth plan? Do we keep putting it off, or is it okay to try to have a baby?
So this has come in general, a discussion that I've had a few times over the past couple of weeks just about our birth rates and number of deliveries and things. And, you know, what we saw in January was a little bit of a dip, and that kind of reflects, if we walk back to the time of conception, right around April and May. And it was not uncommon for us to hear women and families having concerns, but we're in the similar bucket as Taylor. But I will say that we had our busiest month of new OBs in years in January, and I think a lot of women are feeling the same sort of, it's going on, what do I do now? And, I think that it's an important discussion to have with your physician, because for some women, putting off pregnancy isn't the best option. They might have age, increasing age or other comorbidities, but we are gaining information as we go on in this pandemic. And I think a lot of women are having those discussions and realizing that there are now, with the vaccine and our knowledge of, infection control, that pregnancy can safely be undertaken at this time.
Yeah, I think, Carrie, that question is very individual and personal on a good day, more or less, with the pandemic, and all of the factors that you identify are things that anyone concerned really should be discussing with their obstetrician, I think, to make sure that decision is right for them at this point in time. But the general answer is you don't have to avoid it because of the pandemic.
No. I think that, we were worried, a year ago, right, that what we didn't know, but we've gained knowledge over the course of the past 11 months, and I think that we feel okay with pregnancy and our discussion of the vaccine and testing protocols and treatment in pregnancy and different things like that. So for most women, that answer really is it's okay to attempt pregnancy.
Elizabeth is a follower, and she says that pregnancy has been listed as an increased risk to allow people to receive the vaccine in Johnson and Jackson counties, and she wanted to know if you had heard that.
I have not seen that listed as the only reason to receive the vaccine. Dr. Wilder Hawkinson, have you?
I think that pregnancy has been listed as one of the conditions down the road, not in the current phasing, but down the road that might put you out of, say, phase 4 or phase 5 based on age. And so I think that's probably the distinction here. In Johnson County, in all of Kansas, actually, right now, we're not vaccinating anyone based on any specific risk factor other than age. So it doesn't play out currently. But I do think it's fair that in the long run, we understand the reasons that might be a benefit to early vaccination for pregnant patients. And I think that we know, for example, in the Missouri plan, some more specific comorbidities have been called out. And and pregnancy is not a comorbidity, but conditions that might place you at increased risk. And so I think it's fair to say that we know that pregnancy is considered in that group of things, but it's not an impact presently, at least in how we're administering vaccine based on the state plan.
Yeah. And, I would have to look at the exact wording, but I agree with you. I think the main driver in phase 2 is obviously the age. But even after pregnancy, before that, I would say that diabetes and obesity and morbid obesity are much higher risk conditions than pregnancy itself. We've talked about how there is an increased risk of pregnant versus non-pregnant females for admission to ICU and outcomes. But we'd have to look at that exact Johnson County wording.
Lisa has a question about age, getting pregnant in a time of a pandemic. She goes, is there an age, Dr. Wieneke, that you consider higher risk in pregnancy with COVID?
I think that probably also depends a little bit on each individual patient. We, on a global scale, use 35 as advanced maternal age. And when we look at sort of discussions of fertility and perhaps referral to an infertility specialist for help getting pregnant, that time also changes after the age of 35. So on a big global sort of generic time, answer would be 35, but also considering there are other considerations as comorbidities and things that would perhaps change that for each patient.
All right, and Cheryl has a vaccination question. She said, I'm sorry, I may have missed this, but I got my second vaccine yesterday. So far, I've had no symptoms. Will I still get side effects, or am I in the clear? And if I don't get symptoms, does that mean my shot didn't work?
Lots of good questions in there. Yeah. Maybe, Dana, you can start with if I don't have side effects, does that mean my shot didn't work?
Yeah, there's no correlation between getting side effects from getting the vaccine and the amount of immunity that you develop. So I would say no. If you did not get any side effects or adverse problems, shoulder pain, fatigue, aches, then I think you are one of the lucky ones and you're doing good. But there's no evidence that you are not mounting an immune response or don't have that boost response. So I would not worry about that aspect of it.
And on the front of side effect timeline, I think some of that has actually varied based on the manufacturer as well. So Pfizer, for example, we had seen people with a little bit more delayed response, maybe 24 hours or more before the side effects started, while the Moderna, sometimes people have said that same day, 6, 8, 10 hours later. But either way, I think those symptoms have lasted for maybe 36 hours, or the window is up to 36 hours after your administration. Yeah, I would say by 12 hours you should start to feel something, but we know that it can be prolonged. We also know that once you do get it, especially for the second dose with Moderna, I believe, an average of 3.5 days that you have the symptoms. But we also know there can be some delayed effects, such as hives or skin lesions around either the vaccine site or on your body, and that can happen even a week later. Again, nothing to be concerned about. But hopefully, as the day moves forward, you will continue not to have any symptoms. I would wish that upon you. I should say that after my first dose, I had a little bit more shoulder pain than I did after my second dose. I know people who had first dose issues with fatigue and myalgia felt like they got hit with the flu. But on their second dose, felt perfectly fine. So it's just a variability there on an individual basis.
Okay, Caitlin's going to get our last question. Of the women who became pregnant during the vaccine study and presumably have given birth at this point, have there been any studies conducted on the outcome of those births, including immunity that might be beneficial to the infant?
Carrie, you want to start?
Sure. So I'm unaware that they have followed immunity yet in those babies. I do know that they were following those women, and the initial data showed no increased risks during the pregnancy. There was, and remember, this was a placebo-controlled trial, so there was actually 6 miscarriages that occurred. Those 6 miscarriages occurred in the placebo group, which was a saline injection. But I am unaware of any of the outcomes of the babies.
Yeah, I would agree. I've not seen any data or published study that talks about immunity transferred to those children after delivery. And I think that it's probably true that many of those women have delivered now. Because those trials, it's hard to remember when those phase 2 and 3 combined trials started. But in any event, I think the overall evidence that we have from those patients is that the safety profile is very sound. There's not really concern, at least in those small numbers. And as we've mentioned, the tracking of those patients who are at some point in their pregnancy and receiving the vaccination after EUA here in the U.S. or really around the world has really reinforced that information. All right. Well, thanks for great questions again this morning. Tomorrow, Amanda Cackler joins the conversation to help answer your questions from the week. We look forward to that. As always, there's a lot to catch up on from this week. As we wrap up today, any final thoughts this morning, Dr. Wieneke?
No, thanks for having me. And again, I just think it's important that pregnant women are offered the chance to receive the vaccine if they are in a group of individuals that are eligible based on other criteria, and certainly support that and encourage, if there's questions that people have, to reach out to their physicians for discussions as well.
Yeah, thank you, Dr. Wieneke. Great answers to great questions. You know, we will try to keep up to date, and if any more data comes out about the vaccine studies and the pregnancy and after giving birth as well, we'll continue to keep updated on variants as well. So a lot of news to come out, especially you know, next week. I think we have Johnson & Johnson maybe going up for the EUA, but lots of things to be excited about, hopefully. And we will try to get out those vaccines to as many people as we can as soon as we get those allocations.
Yeah, I'd echo all of that. I think, you know, we'll continue to advocate in every way we can for our patients, in every patient population, age, pregnancy, comorbid conditions, all of those things. And we'll also continue to work as hard as we possibly can to get those doses of vaccine that we receive to our patients and those in our community just as quickly as we can. And in the meantime, we mentioned a few things you can do to help us there around our vaccine clinic work, but also remember, as a parting thought today, that you know exactly what to do to prevent yourself from contracting COVID and to prevent transmission in our community. And as we continue to talk about these things that are so important around vaccine, that the pillars of infection prevention and control do really remain your best tool in this fight against COVID. So have a great day, and we will see you back here tomorrow.